There are new concerns. The Ford government's plan to move more surgeries out of public hospitals could cost taxpayers. New data out of Quebec has revealed the government there has paid significantly more for surgeries at for-profit clinics.
The people are worried, and rightly so.
Data obtained through an access to information request by an independent Quebec research institute has revealed stark differences in surgery costs depending on where they're taking place. A cataract surgery cost the government an average $800 at a public hospital, but almost $1,200 at a for-profit clinic, a 45% increase. The cost of a carpal tunnel surgery averaged under $500 publicly, but $900 privately, an 84% increase. The findings were similar for 3 other procedures. The researcher who made the data public wants governments to use it.
When we have such a good comparison, such a result, such a clear result, we should use it.
What's our goal, right? If our starting point is to deliver the highest quality care at the lowest cost, then investor-owned care is not the answer. There are better ways to do that. It's to invest in not-for-profit services that either are operated as extensions of hospitals or standalone community clinics.
In Ontario, it's unknown just how much the province will pay for surgeries in for-profit clinics. Confidentiality agreements make it impossible to know the real costs.
When we're spending public dollars, this sort of transparency is really important so we know we're getting value for money.
But health policy researchers tell us there's a growing body of evidence across Canada and around the world about the higher cost of for-profit healthcare delivery.
I would expect there's no reason to believe that we would see costs lower in Ontario.
What we do have are some national examples. The average cost of a hip and knee replacement at a hospital in Canada is anywhere from $10,000 to $12,000. That same procedure is reportedly up to $28,000 at a for-profit clinic.
If we want to be moving towards a more cost-effective system, we should be focusing on improving the public system.
The Ford government's main selling point has been that private delivery will help clear the surgical backlog and reduce wait times. But research from the Canadian Institute for Health Information shows Ontario has substantially better wait times for joint replacement than provinces outsourcing those surgeries. 73% of Ontarians received a hip or knee replacement within 6 months, compared to 70% in BC, 53% in Alberta, and 48% in Quebec.
The biggest issue is the workforce, and it's under tremendous strain. So what happens when you pull that workforce into the private for-profit sector is it means you're impacting your ability to deliver those same services in the public system.
We reached out to Ontario's Minister of Health for comment, but they didn't get back to us before airtime. For City News, I'm Tina Yazdani.